Welcome, I'm Becky Kaiser here at Hayes Med to talk about coronavirus with some health specialists in our community. These are questions that have been coming from you on social media, also to the hotline at Hayes Med. And of course, Hayes Med is part of the University of Kansas Health System. We're doing this today because we want you to know about what the health situation is in Ellis County, who the experts are that you can turn to for the answers that you need as we talk about the COVID-19 virus, also the hotline that is available to you at Hayes Med, and what questions have been asked from patients around the area. Dr. Roger Dietz is with us now, and he is the pathologist at Hayes Med. First of all, Dr. Dietz, we need to know, what is a pathologist? What do you do exactly?
That's a really good question, and it's kind of a complicated answer. The simplest way to say what I do for the majority of my job is I'm the guy that decides if you have cancer or not. If you have a funny looking skin lesion and your primary care physician shaves that off, it's going to come to the laboratory. We're going to process that, look at it under the microscope and decide, oh, that's nothing to worry about, or no, this is something concerning. You've got squamous cell carcinoma, let's say. But then so that's kind of like the anatomic pathology side of things, and then there's the clinical pathology side of things where a pathologist is going to be the person who is ultimately in charge of and responsible for running a laboratory, like say in a hospital setting. And so that's one of the reasons I'm here, is because we are working very diligently to make sure that we are providing appropriate and good testing for COVID-19.
What does it take to get set up for that? As we speak, no cases have been diagnosed in Ellis County. We know that the medical center is a regional health provider.
Correct.
How are you preparing for this?
We're doing everything we can. Right now, there is testing available here in Hayes. We're actually in a very fortunate spot because Hayes Medical Center is partnered with Quest Diagnostics. And so we're currently using them as our reference laboratory for all of our COVID-19 testing. And their turnaround times has actually been excellent. Almost all of our tests are coming back within 24 to 48 hours, which if you hear what's going on around the nation, that's pretty good.
Compared to weeks, we've heard sometimes.
Up to weeks sometimes. So we're in a good spot there, and we're also working very diligently to bring in the equipment we need for in-house testing, to where if you have a patient that's very acutely ill and we need an answer very quickly, we hope to have the ability to run that test actually here in the laboratory at Hayes Med. And like everywhere else, it's a supply and demand thing, but we're working as hard as we can and doing everything we can to make sure that we have the best available and quickest testing for our patients.
And then those results of those tests, whether at Quest or in-house here at Hayes Medical Center, are reported to KDHE?
Yes, they are.
And that when we see this information that they're providing to us daily, it's listed as KDHE tests, I think, and then also what, independent labs?
Private labs.
Okay.
And so the Quest tally would be in the private lab portion of that website.
I understand that there might be a market for at-home coronavirus test kits. Is there, and are they reliable?
There certainly is a market for at-home coronavirus testing. And that sounds great, right? If you want a test, you can get a test. Unfortunately, it's way stickier than that. First of all, we just simply cannot recommend that you seek a medical test that has not been ordered by either your primary care physician or advanced practice provider. Number two, the majority of these take-at-home tests are not FDA approved, so they haven't been rigorously tested to make sure that the testing results are accurate and reliable. Number three, they require you to give yourself a nasopharyngeal swab to collect the sample. And not to get too graphic, that's a pretty invasive procedure. It's not like you just stick it right up your nose and swirl it around. Like, you need to get way back in your nose. And so without proper training, it is highly unlikely that someone could actually sample the correct area of their nasal cavity.
Or maybe to actually do some damage to themselves.
Certainly you could wind up in the ER with an extremely bloody nose if you don't know what you're doing. The point is it's very difficult to collect the specimen by yourself, so there's a very likely chance that you will not get the proper specimen, and even if your test is negative, it's a false negative. Now, I've even heard that some people that are supplying this take-home test is encouraging you to go to your primary care physician to help you retrieve your specimen, and I would have to strongly discourage that for many reasons I can't get into. It is very unlikely that your primary care physician is going to help you collect that specimen so you can do your at-home COVID test. And lastly, the reason I would like to discourage it is even though we're making progress day to day, week to week as a nation as a whole to increase our testing capacity, we are simply just not at the place where we should be testing people just because they want the test. The testing needs to be reserved for those people who are exhibiting the COVID-19 symptoms and are feeling, right now, you look at states like New York and even in Kansas City metro area, if you're not sick enough to be hospitalized, you're not sick enough to get a test. And that's just where we are as a country right now. We're rapidly evolving. 3 or 4 weeks from now, that might not be the case, but as of today, it's just simply not good practice for anybody to try to do a take-home coronavirus test.
Well, we do know good practice is wash your hands, wash your hands, wash your hands. We've talked about that a lot, and I know that that's being emphasized. Doing that actually, why is that a good thing? What happens when we wash our hands, and what do we need to use to do that?
Well, so there's lots of things about this virus that make it scary and make it hard to know exactly how to prepare for this virus, because one of the things one of my colleagues talked about was that you can be symptomatic or you can be spreading the virus and not be symptomatic.
Right.
But the best thing about this virus is it's easy to kill if it's on your hands. Soap. So the virus is surrounded by what's called a lipid bilayer. It's basically the outer surrounding of the virus is just fat, and nothing dissolves fat better than regular soap. It can be just your liquid gel soap or good old-fashioned hand soap. If you're washing your hands correctly, getting both sides of your hands in between your fingers for at least 20 seconds, the virus stands no chance. Your hands will be free of the virus.
And you said either liquid or the bar soap. What about, we've seen runs on the alcohol-based sanitizer. Do those work as well?
They do work. Soap is your best option, but the alcohol-based sanitizers do work. You do want to try to be using a product that is at least 70% alcohol. Those 70% and above are the best. But certainly soap, just wash your hands with soap.
Soap is great.
Soap is great.
What about maybe you're having to work at your office as an essential business employee and have the wipes that, again, there's been a run on those as well, but the disinfectant wipes, are those a good substitute?
The wipes would be more for using on hard surfaces. In a pinch, you could use them to clean your hands, but I would just wash your hands with soap. I think that's really the best advice I can give.
And as a reminder, Dr. Dietz, this is spread, it's a respiratory, something similar to flu, but more dangerous.
More dangerous, and how it's spread, okay, we have to remember that this is a novel human pathogen, meaning that this is the first time that this particular COVID-19 coronavirus has been shown to cause disease in humans. So everything we know about the biologic behavior of this particular virus, we've learned in the last 2.5 months. So the picture is certainly not complete, but what we do know, the vast majority of the evidence suggests that the vast majority of the human-to-human spread is caused through respiratory droplets, which are the liquid that are expelled from your mouth and your nose when you cough and when you sneeze. And that's why when we talk about social distancing and being 6 feet apart, you want gravity to be your friend. If someone sneezes, you want those particles to hit the ground before they touch you or your clothing. And so that is the main mechanism of transmission. Now, the virus has also been shown to survive on hard surfaces, depending on the type of surface, anywhere from a few hours to maybe a day or more. So it is certainly possible that someone who is infected sneezes on your countertop, and then you touch that countertop, your hand is now contaminated, and then you touch your face. You touch your nose or your mouth, you can become infected that way as well. And so that's why cleaning your surfaces, at your home once or twice a day with a Clorox, and actually there's almost any household countertop cleaner will be sufficient to rid your countertops of any potential virus. And then the mechanism that I think is getting the most attention right now, and the short answer is we're just not sure, is whether or not this virus can be aerosolized. And that is when a virus survives on much smaller particles that can remain suspended in the air for a much longer period of time. Say someone is infected and is breathing very heavily and just is in an elevator, let's say, and then they get out of the elevator and then you get on the elevator. Can you breathe in the air that was in that elevator and become infected that way? And there is absolutely no solid evidence that that is the case. There are some preliminary studies that show the virus can survive in certain lab conditions as an aerosolized form, but it is just simply not known right now to what extent, if any, the aerosolized version of this virus causes human-to-human transmission.
We are looking for a vaccine?
Oh, absolutely. We're looking for a vaccine, and there are many labs. It's a global effort, and there are many labs that are developing vaccines. But people have to understand that process takes a long time. You have to develop the vaccine, you have to prove it effective in animal models, and then you have to do a small trial on humans that needs to be tracked for several months to make sure that this vaccine is safe and it's effective. Remember that as physicians, our #1 rule is to do no harm. And so as much as we would like to have a vaccine tomorrow, that's just not in the cards. The best case scenario is probably a year from now having a commercialized vaccine. But there are certainly people working endlessly to try to get the vaccine out as quickly as possible.
Dr. Roger Dietz, who is a pathologist at Hayes Med, thank you so much for joining us.